Hey, welcome back to another video. My name is Lasitha. I'm a 5th-year medical student at KDU. And in this video, I'm going to address a question that a lot of you, especially foreign students, keep asking. And it's whether you need to know Sinhala in order to be able to complete your degree. And the simple answer for that question is yes, but stay tuned to find out a little bit more about what you can do in order to be able to overcome this issue if anyone has a language barrier. Now, the first thing that I'm going to say is that our course here at KDU or any other government university here in Sri Lanka is done purely in English. From your first year until the 5th year, everything from theory to clinical stuff will be taught to you in English. But from 3rd year to 5th year, you'll be exposed to clinicals where you have to speak with patients. And the likelihood is that you won't find patients speak in English. So far, up to from 3rd year to 5th year, I've been able to find just about 5 patients that spoke to me in English. They prefer to speak with me in English rather than in Sinhala. All the other patients have spoken to me in Sinhala. Thing is, there might be even patients among the ones that spoke in Sinhala that knew English, but the reality is that these patients come to the hospital in distress, concerned about their health. The last thing they want to do is to speak to a doctor in English when they won't be able to express their feelings and the symptoms that they're having. So just to make everything easier for them, especially if you're a Sri Lankan, then they would expect that you speak in Sinhala with them. So we do have a lot of Bhutanese students, for instance. Their first language is now Sinhalese, but a lot of them have come to our courses here in Sri Lanka and they have started to speak our language. But a few of them still struggle, so the first thing they do is when they approach a patient is ask whether they speak English so that they can speak with them in English, and a lot of them do. So they try to speak in English with them, but obviously then the language barrier can cause a few issues, okay? But the reality is, if you're a Sri Lankan, then they'd expect for you to be able to speak in Sinhalese with them. So what can you do in order to overcome this language barrier if you do have one? The reality is, a lot of us coming to KDU do speak Sinhala, but there are a few that don't. Like myself, when I started the course, I knew zero Sinhala. I was able to understand the language, but I was not able to speak it. But now, as a 5th year, I find it so much easier to speak. I can speak confidently. So there are a few things that you can do along the way in order to improve your Sinhalese, and that's what we're going to be talking about in more detail in this video. So now the first thing is, in first year when we started back in 2020, the university had only an English course which was provided for day scholars, so all the foreign students and the cadets. So now that has changed because there's actually no need for us as foreign students, as we know English, being brought up in English spoken countries. Obviously there's no point for us to have an English course where we learn about the grammatical issue, pronouns and verbs. Those are not things that are much of a concern for us, but will be much more concern for the local students. So now, since a couple of years, KDU has started a Sinhala course as well as an English course. So people who don't speak Sinhala will go for the Sinhala course, and obviously likewise for the English course, and local students, cadets, they would all go for that one. So that's actually a really good thing because you start to learn about the language, how to read, how to write, how to express yourself verbally, and also a lot of those technical terms that you need to know in order to take histories from patients. Now you'll be able to have a chance to grasp all of that through this English course that will be run during the first 1.5 years of the time that you'll be spending here at KDU. So for us it was different because we didn't have this. So during 3rd year I hired a tutor that helped me for about 5 to 6 classes to go through the most common questions that as a medical student I'd have to ask from my patients, like what is your name, where are you from, why have you come here to the hospital,
or more technical stuff. For example, when was your last period? How many days did your period last? So after 5 or 6 sessions, what I found is that every time I would go to a patient and ask those questions, it's every time you just keep repeating those questions, and after taking histories for 1 or 2 months, it becomes natural to you. So eventually, after the third year, which was our first year where we started clinicals, we were able to take histories from start to finish without any problem. And especially I had also friends, Tamil friends, that were not able to speak Sinhala. So within the first year, they grasped the language. They were able to take histories from top to bottom without any issues. The thing that you want to take away is that you will be struggling during the first couple of months, but eventually it will become easier. And the thing is, there are a lot of cadets, there are a lot of local students now, since local students can now apply as day scholars as well, that will be able to help you out if you have any issues with the language. So now throughout the course, you will have help from the university and from your colleagues themselves that will be able to help you out in order to grasp the Sinhala language. So eventually, by the time you finish your 5 years, the likelihood is that you'll be able to speak the language fluently. So with that said, I hope you guys got an idea of how important it is to know Sinhala in order to be able to carry out the medical degree here in Sri Lanka. But the thing is, you will have help throughout the 5 years in order to improve and to learn the language. And if you struggle, there will always be there someone in order to help you out. So with that said, I hope you guys enjoyed today's video, and if you did, leave a thumbs up down below. If you have any questions, as always, leave them in the comment section below, and I'll see you guys in the next video. Bye for now.